Cephalosporins. Cephalosporins are cell wall synthesis inhibitors and also called as beta-lactam antibiotics. You will be able to classify cephalosporins. Explain the mechanism of action of cephalosporins. Enumerate pharmacokinetics and adverse effects of cephalosporins. Describe mechanisms of bacterial resistance to cephalosporins. Cephalosporins are beta-lactam antibiotics. They are derivatives of 7-aminocephalosporanic acid and contain beta-lactam ring in their structure. Closely related structurally and functionally to the penicillins. Than penicillins, to bacterial beta-lactamases. They have broader spectrum of activity. And they are bactericidal. The mechanism of action of cephalosporin is that cephalosporins, like all beta-lactam antibiotics, interfere with the last step of bacterial cell wall synthesis. Transpeptidation or cross-linkage. They are only effective against rapidly growing organisms that synthesize a peptidoglycan cell wall. The cephalosporins are classified into 4 generations on the basis of their antimicrobial spectrum of activity. As the generation increases, gram-negative coverage increases. Gram-positive coverage slightly decreases, except some 4th-gen drugs which regain strong gram-positive activity. Generation cephalosporins have agents like cephalexin, which can be used orally, cefazolin, it can be used parenterally. First-generation cephalosporins are active against gram-plus-Va bacteria. They are indicated in urinary tract infections, cellulitis, soft tissue abscess. Cefazolin is drug of choice for surgical prophylaxis. Second-generation cephalosporin includes agents like cefaclor, cefuroxime, cefamandole. They have more gram-Va coverage. Second-generation cephalosporins are used in infections of sinusitis, otitis media, lower respiratory infection, pneumonia, and peritonitis. Third-generation cephalosporins agents include ceftriaxone, cefixime, cefotaxime. They have extended gram-Va coverage. Some agents can cross blood-brain barrier. They are indicated in serious infection caused by gram-negative, hospital-acquired infections, and meningitis. Fourth-generation cephalosporins are cefepime, ceftaroline. Cefepime is used for Pseudomonas infection. Ceftaroline can be used for MRSA, methicillin-resistant Staphylococcus aureus. Pharmacokinetics of cephalosporins. Most of the agents are given through parental route. After absorption, cephalosporins are well distributed in body compartments, having good penetration in soft tissues, muscles, bones and joints. These drugs can also cross placenta and enter fetal circulation. But they are non-teratogenic, so these can be safely prescribed in pregnancy. Both penicillins and cephalosporins are safer in pregnancy. They attain high concentration in aqueous humor. They have high concentration in various other fluids like peritoneal, pericardial and synovial fluids. Most of these agents are excreted unchanged in urine by tubular filtration and secretion. Ceftriaxone, cefamandole and cefoperazone are excreted in feces, bile, thus are safer in patients suffering from renal failure. Adverse effects of cephalosporins includes allergic reactions, identical to those of penicillins, including anaphylaxis, fever, skin rashes, granulocytopenia and hemolytic anemia, local irritation after intramuscular injection, and thrombophlebitis after intravenous injection. They can cause nephrotoxicity. Agents that contain methylthiotetrazole in their structure can cause bleeding disorders like ceforminidol, cefoperazone. They interfere with platelets, causes severe bleeding. Cephalosporins can disulfiram-like reactions. Some cephalosporins, especially those with an N-methylthiotetrazole side chain like cefetadine, inhibit aldehyde dehydrogenase. When alcohol is taken, acetaldehyde accumulates and causing flushing, nausea, vomiting, tachycardia. This is called as disulfiram-like reaction. Resistance to cephalosporins is due to one of the 4 general mechanisms. 1. Inactivation of antibiotic by beta-lactamase, cephalosporinase. 2. Modification of target PBP. 3. Impaired penetration of drug to target PBP. 4. Presence of an efflux pump. Thanks for watching. Stay connected for more informative content of pharmacology.